I'm Sarah Rothenberg. I'm faculty in the College of Health, and it is my great pleasure today to introduce Dr. Donna Mergler. And believe it or not, um, I first met Donna 20 years ago when I was a graduate student, and I attended a conference, a Mercury conference, in which Donna was a plenary speaker. And I had the good fortune to meet Donna again in 2009. And we've stayed in touch all these years. And I just feel like Donna Mergler's work is just seminal when it comes to mercury exposure and human health. Uh, and I'm just so grateful, Donna, that you've made time for us today. So I'm really looking forward to the lecture. And hopefully yeah, so people can ask questions in the Q&A, and I'll do my best to monitor this. I'm just want to make sure I'm getting the question. But yeah, anyway, take it away, Donna. Thank you so much.
Thank you so much, Sarah, and it's a pleasure to be here. And yes, that was 20 years ago. Wow, time goes by quickly, doesn't it? Okay, well, it's a pleasure to be here and talk to you about Grassy Narrows First Nation, and particularly what health science can bring to struggles like the Grassy Narrows First Nation struggle for the recognition of mercury poisoning. Let me just put this. Sorry. What happened? Okay. I'm doing something wrong here. I'm sorry. I will just stop it for a moment. Share. Okay. Let's go back. Okay. What I want to do first is to give you an idea of the history of the story of Grassy Narrows and go back to the reports from the Canadian Broadcasting Corporation back in 1970. So let's begin with this and hope that it works.
A provincial government report has revealed the extent to which mercury pollution is spreading through the province's waterways, contaminating fish to the point where they are unfit for human consumption. Unacceptable levels of mercury have been found in varying species of fish at points in the Ottawa River, the St. Lawrence River, the entire Great Lakes system, and other major bodies of water, all the way up to the far northwestern end of the province. Sport fishermen in the affected area have been advised which species are contaminated and are being told to fish for fun. Such advice is of little help to commercial fishermen and others who have to fish to live, such as the Indians of the Wabaseemoong River.
A provincial doctor came up some months ago, and he went to Grassy and he took blood samples and also samples of hair.
What were the results of those tests? We don't know, and we never heard about them. Nobody ever said anything about the test.
He told us that he would let us know if there was any positive results. We haven't heard anything.
Since the Ontario government first revealed mercury contamination of fish because of dumping from the Reed Paper Company mill at Dryden. That dumping was stopped after our program last fall, but the mercury already in the river will continue to poison the fish and those who eat them for as long as 100 years. Since the Ontario government first revealed mercury contamination of fish because of dumping from the Reed Paper Company mill at Dryden. That dumping was stopped after our program last fall, but the mercury already in the river will...
What happened to the end of this?
Let me see if I can get
Perfectly, obviously, when I tried it. This should be there, and there we go.
And soon the one remaining economic base was fishing for food and profit. Then in 1970, they took that away too. That was when they found the mercury. The government said there was mercury in the water all around here, from the reed paper plant upstream. And they told the Indians not to fish anymore. They said, the fish are poison and will make you sick. But when some Indians said they were ill, the government wouldn't believe them.
Okay, so who are the Indigenous people in Canada? In Canada, Indigenous people have been here since time immemorial, and colonial practices and policies such as the Indian Act, the pass system, reserves, and residential school sought to control and assimilate Indigenous peoples. And this was clearly stated by governments. This citation is from the Canadian Encyclopedia. What they say is such practices and policies, when combined with racism, segregation, loss of land, and declining or unequal access to food resources and public services, have had devastating consequences on the health and socioeconomic well-being of Indigenous peoples. What they leave out here is the environment and pollution that is likewise affecting the health and well-being. I'd like you to hear a bit from Judy De Silva, who's the Grassy Narrows Coordinator for Health and Environment. She's a mother and grandmother who has fought for many years for the recognition of Grassy Narrows mercury poisoning, remediation of the river system, and appropriate care and compensation. She's received many awards worldwide. This is from a talk that we gave in Simon Fraser University, where she said that explained where Grassy Narrows is. So for you, Grassy Narrows is located in the northwestern part of the province of Ontario, Canada. It's geographically close. It's geographically close to the center of Canada. The people were called Ojibwe by the missionaries, but the correct name is Anishinabek, a people that number over 100,000 in North America, and they're called Algonquins. In Ontario, it is one of the larger population of Indigenous nations in North America, and in the Treaty 3 area surrounding Kenora, there are 28 Anishinabek villages numbering over 20,000 people. During the 1960s and early 70s, from 1960 to a chloralkali plant that was part of Reed Paper Mill in Dryden, Ontario, which is upstream of Grassy Narrows, dumped approximately 9,000 kilograms of mercury into the English Wabaseemoong River system. The fish were full of poison, said Judy, and the people from Grassy Narrows, Wabaseemoong and Wabaseemoong, who relied on this, became poisoned. Before the mercury dumping, Grassy Narrows was a largely self-sufficient community. This is important. They had 90% employment because of commercial fishing and sports fishing. Following the closing of the fishing lodge, it went down to 70%, and I don't know why my system is doing this. Before the mercury dumping, it went down to 10%. The mercury crisis has greatly contributed to a loss of way of life, relationships with language. The land and waters on the territory have been harmed, and repairing these relationships is only just beginning 60 years later. So here you can see the Dryden plant is here on Wabaseemoong Lake. It took me a while to figure out how the water got from the Dryden plant all the way along here through Ball Lake to Grassy Narrows First Nation, which is here. We'll see the amount of, okay. So just a refresher on the mercury cycle from fish to people. Mercury is all around us. It's coming from industrial discharges from mining, hydroelectric dams, airborne emissions from coal burning plants, soil erosion, and deforestation. And when it gets into the waterways in the form of inorganic mercury, it is in the it is here in the microorganisms and phytoplankton that are eaten by the fish. And as you go up the chain, the bigger fish that eat the smaller fish, well, they take in all of their mercury. And then the bigger fish are eaten by even bigger fish, so they get even more mercury. And you can imagine at the fishing lodges where the fishers expected to get these really large fish, mostly walleye and northern pike, they were chock full of mercury. And then you have the I'm sorry, I have no idea why it's doing this. Let me just do this and see if it helps. Okay, there we go. Okay, so the humans are up here. We are the high predators. We're at the top of the chain, as are the fish-eating birds and fish-eating mammals. And there we have. Okay, we talked about that. We said that. Oh, I'm going the wrong way. I'm so sorry. Okay, another to just refresh your memory as to methylmercury from fish is ingested and rapidly enters the bloodstream. From the blood, it's distributed to all organs and tissues throughout the body. In the liver, intestinal tract, and kidney, some of the methylmercury is slowly demethylated and then remethylated. There's a demethylation, remethylation cycle there. Methylmercury is mostly eliminated through feces and bile, but when it is demethylated in the liver and demethylated in the kidneys, it is eliminated as inorganic mercury through urine, and a small fraction of blood mercury is eliminated through scalp hair, which makes it really nice for us to be able to cut up the hair and have a measure of at least the previous months of exposure. Methylmercury crosses the blood-brain barrier through active transporters, and this is important because once it gets into the brain, it remains there until it is demethylated to inorganic mercury over a long period of time, and it can remain in the brain with a half-life on the order of years to decades. Also important is that methylmercury is actively transported across the placental barrier. The umbilical cord blood mercury levels are on average 1.7 times. Why does it do that? 1.7 times the maternal blood mercury. Biomarkers for methylmercury are blood, hair, and umbilical cord. And for inorganic mercury, there's urine. Okay, so what was done after this discharge that began in 1972 and continued until the mercury cell process in this chloralkali plant was closed down was changed. Basically, they changed the procedure in 1975. So there was a government mercury biomonitor program, and they took hair, blood, umbilical cord blood that was initiated in the early 70s and ended in the 1990s. Actually, in 1997, when they considered that the average levels were below Canadian guidelines. Health Canada analyzed mercury in blood and or hair samples from over 38,000 individuals from 514 communities across Canada, Indigenous communities across Canada, and over 2,000 umbilical cord bloods. Of these, 23% of individuals tested had equivalent blood concentrations greater than 20 micrograms per liter, which at that time was the Canadian guideline, and 22% of cord blood concentrations were above 20 micrograms, were likewise above, and the 20 micrograms per liter was the guidelines that was used for the entire population, and has since somewhat been changed. Fish were and still are monitored in this fluvial lake river system. During these biomonitoring program, it was a person from Grassy Narrows who had the highest blood mercury at 660 micrograms. That should be micrograms per liter. And here you can see all the map of Canada and all of the places that they were measuring. What health studies were done? In 1979, Dr. Masazumi Harada from Minamata and his team examined 44 persons and reported several cases of suspected organic mercury poisoning. Then the government, the Health Canada, got together a group of neurologists who did neurological examination on several elderly people that revealed effects that may be associated with methylmercury poisoning. However, they decided that a definite diagnosis was elusive. In 1989, Dr. Brian Postel of the University of Manitoba reported on Grassy's morbidity and mortality records from the local hospital. And he said that the community experienced illness and death at rates which far exceed district, provincial, and national standards. And in 2000, Dr. Harada returned to Grassy, and using the Japanese criteria for Minamata disease, he identified 30 of the 73 examinees with a positive diagnosis for Minamata disease, and 12 had suspected Minamata disease. In 2015, Grassy Narrows invited our research group to participate in community-based epidemiological studies to examine how mercury has impacted their health. So these are the studies that we've done that I will tell you about. This is very annoying. However, that I will tell you about, and all of our studies with First Nation are done under the OCAP principles of ownership, control, access, and position of the data by First Nation, by the First Nations that we're working with. And these principles were set down by the First Nations Information Government Center and are respected by our funding agency, our NIH equivalent, which is the Canadian Institutes for Health Research. So what did we do? We did a community health assessment. We looked at historic mercury biomarker data, historic autopsy data, premature mortality, and we did the NIVEN study in the most recent, did the field work in 21-22, and we're continuing to analyze the results. With this, we wanted a portrait of how mercury exposure has impacted their health and welfare, with the view to formulating with the community solutions to improve services, to improve health services to the community. So the community health assessment was the objectives were to provide a better understanding of the health status of adults and children of Grassy Narrows and its determinants. The methods that we used were a house-to-house questionnaire survey And what we did was we used the same questions as the First Nation Regional Health Survey 2008-2010, which was the last one to come out before our study. And in that way, we were able to compare our data with the data from the First Nation Regional Health Survey, which covered over 10,000 adults and children. We added to that questionnaire further questions on known symptoms of mercury poisoning and maternal childhood and current fish consumption, so that we had questions on what did you eat when you were pregnant with this child? How much fish did you eat? How much fish did you eat when you were 10 years of age? And how much fish are you currently eating? Also, what types of fish? So the survey was completed by 80% of the households and a total of 424 adults and 353 children. Our findings were that reported fish consumption, particularly prenatal and during childhood, contribute to their current, this was 2016-2017, poor health and well-being. Not only that, the specific deficits and the long-term effects of exposure were consistent with the scientific literature on the detrimental effects of mercury on health. And in the pictures here, you see Krista Ackaby, who was the field coordinator, without whom this study would not have been possible and would not have been such an incredible success. And the chief, Rudy Turtle, with Judy De Silva and myself, showing the results of the study. Let's hear what Judy had to say about the study when it came out at the press conference.
Sowieso de best cookies ook dus in kaas bijzonder dan klinkt om niet naar nachten mag man snap Bergland job knocking. We started on this health survey like probably 5 years ago, trying to get funding and so on, and we finally got it done, and now the report is out, and it is a report that verifies that we are poisoned by mercury. I've been to so many meetings where not one word was uttered about mercury poisoning or Minamata disease. So it's almost like I felt crazy thinking, maybe we're not, maybe we're just imagining it. But then I always knew in the back of my head, 10 tons of mercury in the river system is highly toxic. And Walkerton went through E. coli, and they got served justice right away. And it's a shame on Canada, shame on the province that we are treated so inhumanely. We are treated below humans. And we are just an example of how the Indigenous people are treated all across Canada, Turtle Island. And I feel like it's a sigh of relief that this expert, this world-renowned mercury expert, has found this evidence. That's what I call it. It's evidence.
So after this, we decided to get more evidence, and Grassy Narrows was able to repatriate, as we say, the historic data, those biomonitoring data that the government had made between 1970 and 1997. It wasn't easy. It did take a front page article on in the Toronto Sun, but it's Toronto Star, sorry. But we used that data to create a unique mercury database. In this database, we have mercury concentrations from autopsies, and we transform the data to equivalent hair mercury measurements. Most of them were hair measurements. And we likewise have cord blood measurements for a total of 765 people. In fact, it's about 600, there are 212 people with cord blood. Okay, the type of analyses this allowed us to do was retrospective longitudinal exposure, LMRMs for those statisticians in the audience. We used cutoff values over time, such as hair Mercury value above 5 micrograms per gram, longitudinal mean or maximum exposure over a certain period of time, as you will see, such as childhood, latent exposure variables, which is a statistically derived combination of exposures. And I just want to say here, because I'm going to show you many of our results, that rather than repeating it all the time, all of our analyses consider the possible contribution of other variables, such as age, sex, drinking, smoking, income, residential school, and because the values were taken over time, age of sampling, and season sampled. So these are the results from the historic autopsies. Firstly, you see the brain, and what is striking is that the mercury is present throughout the brain. It's not just in one area, such as one looks often at the cerebellum, but it is present throughout the brain. And when you look at the individual autopsies, some people will have it more in the cerebellum, others in the basal ganglia, some even in the frontal lobe. So excuse me. So this line is a reference value that comes from a study that was done at the University of Rochester, and these were people that did not have known mercury exposure. Here so this was total mercury, which was mostly methylmercury. In the organs, it was mostly inorganic. And note the y-axis here. It's 10 times the amount that one finds in the brain. So you have the kidney, cortex, and medulla, the liver, and the heart. In each one of you have the where this data is published. So when we look at fish hair and cord blood mercury over time, the top blue line here is walleye consumption, walleye mercury levels over time, that was reported by Rudd, John and all in 2016. And you can see that the levels decreased over time, but began to plateau out here, where at levels that are still high for consumption. One usually uses 0.5 micrograms per gram. The mean hair mercury in everybody, these are mean hair values from our database, is that you can see it parallels what happened to the fish. This is coupled to the fact that people, of course, were eating much less fish and were eating smaller fish. You can see the same pattern here with cord blood that likewise decreased over time. And again, once the levels were below 8 micrograms per liter, which is the Canadian guidelines and not the 5.8 of the American guidelines, the program was stopped. So what did we look at? We had this big database, and the first thing we looked at was the premature mortality. And premature mortality here is death prior to 60 years of age, even though 75 years of age is where one considers premature mortality. But to be honest, we did not have enough people to be able to do, despite that there were a large number, we did not have enough people who had lived beyond 75 to use 75, 70, so we use 60. 222 individuals were born before August 1959, so they could have reached 60 years old when we did the study in August, when we analyzed the data in August 2019. Almost 70% had died. So what did we do? We paired cases. We used a matched pair type of analyses. We paired dead persons with controls who had lived beyond 60 years of age on year of birth and sex. And we came up with 36 pairs. You can see in the diagram, the graph on the right, that 17 pairs of women, 19 pairs of men. And the black line here with the black are the cases, that is, those who were dead, whereas the dotted line with the open circles are those who lived beyond 60. And so you can see very well that the exposure was considerably higher among those who died prematurely. Longitudinal hair mercury concentration indeed was 4.7 micrograms per gram higher in those who had died compared to controls. And we did, because we have a relatively small, I mean, we're not talking about NHANES or, large studies. We always do different method. We use different methods in order to validate and to confirm what we are saying. So we did survival curves for this. We did age to death with respect to mercury. We did longitudinal analyses, and these all confirmed our findings. They all showed the same. We likewise looked at childhood mercury exposure and early death. We selected people from this large database who had provided hair samples between the ages of 5 and 15 years of age. It was 317 children had complete information. 97 had died between 1975 and 2024. Now, most of you are probably younger than my children, but this is the age of my children. So here, if you look at the survival curves, you can see that the blue line are those with lower mercury, maximum hair mercury levels, less than 4 micrograms per gram. And these are the lower are those with higher mercury, who indeed are dying at an earlier age than those with lesser mercury. The reported cause of death, these are the families that reported what did the person die of, and the youngest curve there is for suicide, and then you have both liver disease and cardiometabolic diseases that begin around the age of 30, and half of them are at about 38. So because of the importance of suicide, we went back to the community health assessment to ask the questions about suicide. And here you see the results from the adults and adolescents. The first bar graph is family members, a close friend completed suicide. The dark blue is Grassy Narrows. The lighter blue is First Nation. And when we had it, First Nation Ontario, then First Nations Canada, and the grayish blue is non-Indigenous Canadians. So you can see that Grassy Narrows in all of these among adults was higher. And among adolescents, for girls, it was 3 times higher than the attempted suicides in Grassy Narrows compared to other First Nation communities, and twice as high in boys. Now, as you know, suicide is an important issue. in First Nation communities, and like other things, due to multi-causes. What we did structural equation models. I'm not going to go through the structural equation model, but there you can see what the structural equation model is, and the validity, the reliability of this analysis when putting it in a more easier thing to understand. You can see that we began with the grandparents. We used a matrilineal line. So what the grandparents were eating, if the father was a fishing guide, this was well known. The fishing guides had the highest levels of mercury, and the mother's umbilical cord blood was was reflected the grandmother's fish consumption. So we had mother's childhood mercury exposure, which was to which mother's the umbilical, which was associated with the mother's umbilical cord, and also with the grandfather being a fishing guide. The mother's childhood mercury exposure contributed to mother's nervous system disorders, which in turn contributed to mother's psychological distress, which, as we know, there's a large literature on mother's psychological distress and children and youth's mental health. So let's look at what happened with the grandfather fishing guide. There's a culturally, if you eat fish, the family eats fish. There was the women during pregnancy whose father had been a fishing guide. So the children's grandfather had ate more fish than others. So if we get down to the red area here, maternal fish consumption during pregnancy and mother's psychological stress was contributing to children's and youth mental health, which in turn was contributing both to children and youth's emotional and behavioral problems and children's and youth mental health contributed to their increased risk for attempted suicide. We didn't observe any association with respect to youth's current fish consumption. Well, once we saw this, we decided to do with Grassy Narrows, we decided to do an extensive health examination where participants were selected on the basis of available data on past mercury exposure. In 2021, we did a first group which had at least 4 year-based measurements of mercury exposure, and 222 with umbilical cord mercury concentrations. Some of them had both, but not sufficient numbers to be able to adequately analyze. They answered a questionnaire, and we did examinations at the local school, general physical examinations, blood work, including blood mercury, neurological examinations, tests of motor and sensory functions, eye and vision, psychological and neuropsychological tests. We looked at symptoms of nervous system dysfunction. One of the things we had a long number of symptoms, and treating them individually didn't seem logical, because they're usually, when you have one symptom, you have a group of symptoms. So we used cluster analyses. There were 391 people, and it clustered very nicely into sensory impairment, extrapyramidal impairment, cranial nerve disturbances, neurocognitive deficits, gross motor impairment, affect, and mood disorders. And depending upon the cluster, past mercury exposure, be it prenatal childhood and or adulthood, was related to the different clusters. When we did the NIVEN study 5 years later, 85 people had participated in both. We analyzed the same cluster all cluster symptom scores had increased, and the rate of increase was significantly associated with long past term mercury exposure. Of course, it was also associated with age, but both age and long-term past mercury exposure contributed to the rate of increase of symptom frequency. We looked at cognitive loss and did longitudinal analyses. What we used the MOCA, and because I don't feel that the MOCA really represents the actual score for Indigenous peoples, what we did was we regressed it on age and educational level, and then looked at those who were lower for their age and educational level and higher for their age and educational level. And there you have the graph of equivalent hair mercury values for those who were lower for their age and educational level. That's the blue line, the upper line, higher mercury exposure, and those who were had scored higher for their age and educational level, and you can see that their mercury levels were lower. 3 optometrists carried out extensive eye and visual examinations, and overall the prevalence of many visual deficits was higher in Grassy Narrows than in general populations. Here you can see in this diagram that visual and field constriction increased with past long-term mercury exposure. These are heat diagrams where this is less than 3 micrograms per gram, between 3 and 10, and this is greater than 10 micrograms per gram. Of course, we also looked at longitudinal analyses that confirm that these findings, there was an increase in visual field constriction with past long-term mercury exposure. Also, we looked at retinal thickness, which likewise decreased. This was the first one that we saw that decreased with increased umbilical cord blood mercury concentration. So this is adulthood, whether this occurred in utero or throughout life, or maybe a mixture of the two, but this was highly related to umbilical cord blood mercury concentration. Now, this is what we're currently doing. The scientific literature indicates that methylmercury exposure can affect multiple organs critical for glucose homeostasis, and we are currently examining possible associations between past and present mercury exposure and indicators of metabolic functions, diabetes, and risk factors for cardiometabolic syndrome. Well, all of this and what it leads to the possibility of, once we've said, okay, mercury is a problem, and very often the problems that we are observing with mercury are not necessarily those known by caregivers. When we spoke to the Low Vision Association of Ontario and discussed our results with them, their response was, well, we wouldn't know what to do. Our training is not for visual field constriction. It is for loss of visual acuity. And these people have very good visual acuity, but as you can see in the case study there, those are the results. That's one result of visual field constriction. So Dr. Joel Nemergut of the University of Montreal has been working on he's a visual rehab specialist, and he's working on a protocol for vision rehabilitation with both a interview and observation, screening and validation to come up with a service delivery model that will be used in the community. And one of the things that they've noticed is that indeed, even what one would expect from loss of visual field is that the problems are not similar to those you see in other situations. So they're doing both interviews and observations. So why are we doing all this? Because we go from, we're trying with the community, and this is, if you remember at the beginning, it's to improve their services, from evidence to action. So mercury exposure is on a continuum of severity effects. In the initial cases, one sees subtle changes which impact the individual and the community, and that you can only determine with epidemiological studies. You then have subclinical symptoms of this dysfunction, and finally, multiple comorbidities with mercury. What can be done is that these subtle changes, you can have community initiatives, school training programs, all sorts of different activities that are directed to the community. For subclinical symptoms and signs, treatment and therapy programs, and finally, for multiple comorbidities, long-term care. And this is what the Grassy Narrows had been asking for ever since the Dr. Postel study in 1989, that there be a Mercury care home. It was one of his recommendations. And so the Mercury care home, that I'm happy to say is in its process of construction. It's a beautiful building. And there was a detailed services plan that reflects what our findings over the past 10 years now. And the whole thing is there'll be community wellness programs and traditional healing. Persons with subtle changes which impact the individual and the community can go directly to allied health services, which will be open to the entire community. Of course, there will be primary care, specialist care, and for those with neurologic, neuropsychiatric, and systemic conditions, there will also be resident care. And this is an example of all of the services that will be available, and each one was justified with either with our studies and a review of literature, land-based and traditional healing, food programs, physiotherapy, occupational therapy, mental health, cognitive therapy, speech and language, recreation, vision care, audiology and oral care, and oral health. I'll finish with the words of Judy's daughter. My Shumish was which is grandfather in Anishime one generation, were the last ones to witness what Grassy was like before the mercury pollution. And it is overwhelming to think about my generation never seeing healthy land and healthy people in my community. And there is a new pollution threats from a mining company. She says, my mom's generation resembles the long history of finding the mercury and figuring out how to begin the process of remediating our waters. And it has been my honor to work with Judy and the community in order to help to find out what is mercury doing and how can we at least improve the quality of life of the people of Grassy Narrows. Thank you.
Donna, thank you so, so, so much. I am so grateful to hear your talk. I want to first ask people either here or online if you have questions. Anybody here want to start? Obviously I have tons of questions, but let me ask people here. Do you want to ask anything in general about Mercury, about Grassy Narrows? Please.
Yeah, what is the current situation of mercury in the river system?
Well, there's still mercury in the river system, and there's two things that. One of the reasons is that because of the type, and now I'm not a biogeochemist, so my understanding, I'll give you what my understanding of it is. Okay, is that it's a very complex fluvial lake system, and it was with scientists working with Grassy Narrows back in 1985 that said there's still mercury on the top of the sediment, which there should not have been, because normally it would have gone down as it does in hydroelectric reservoirs. But it was still, a lot of mercury was still on the top. And there have been lots of studies, and a fellow named John Rudd, who wrote a very good paper on why there's still mercury in the Wabagoon River system. And one of the reasons is because of the type of ecosystem that it is, that with lakes and bays and currents, so that it makes it, remediation is a complicated process. The other thing is that recent studies have shown that the pulp mill that is still there is pouring a lot of sulfates into the river system, and the sulfates are increasing mercury methylation. So the inorganic mercury, a lot of the inorganic mercury is still there, and it's being transformed even more rapidly into methylmercury because of the sulfates.
Yeah, that's right. The sulfate reducing bacteria will be very happy if they have lots of sulfate. They will produce lots of methylmercury. So I didn't really realize the contribution of sulfate. Other questions? Anybody? Please, Mathieu?
Yes. Well, first of all, thank you so much for that wonderful presentation. I really appreciate you are still uh, giving to us all this experience. I think it's so valuable. It's so important for us. So thank you so much. And my question is about what is the main characteristic of mercury that why so toxic? Because we could see that you could find mercury in the brain, in the eyes, in around the entire our entire body. So what is the chemical characteristic? What is the characteristic that makes mercury being so toxic?
Oh, I wish I could. I am not a molecular biologist. There are others who have studied this extensively, and there is an extensive literature on on mercury toxicity and how it interacts uh, with neurons, with astrocytes, with glial cells in the brain. One of the reasons for methylmercury's high toxicity is that because it's in the form of methylmercury, it can incorporate itself into many of the body's the normal processes, in the same way that it is actively transported across the blood-brain brain barrier and across the placental barrier. It is because the receptors recognize it as being a as being not as being something foreign. So that makes it highly toxic because it does not play the role that if it weren't methylmercury that it would pay, and it likewise takes the place of other substances. And if somebody there can give a better, I'm sure somebody there can give a much better answer than I can, who has studied much more the cellular and molecular aspects of methylmercury toxicity.
More questions? More questions? Please.
I was just curious, you had mentioned the use of traditional healing in the Mercury care home that is being built right now. To what extent is that being used and what do those practices look like?
Did you hear the question?
Yes, I heard the question. Thank you. The traditional the traditional healing, and a lot of people are studying traditional healing and how traditional healing is relevant for a lot of the illnesses or dysfunctions that we are encountering, that we encounter. However, in the what is incorporated into the Mercury home is that there will be, for people who wish to consult with or sit down with traditional healers, both for mental and physical wellness, that it will be available to everybody, and it will be there. It's sort of the mixture of traditional and Western medicine. The Mercury home is not built yet. It should be finished. I was in Grassy last week and visited the site. It's the construction is going really well. It was a beautiful design by an Indigenous architect, and it will hopefully open its doors by next year, probably the end of next year.
You.
More questions? Yeah, I will just ask and just I'll just note some things. What makes your research on Grassy Narrows amazing is the intergenerational aspect. This is something that in human studies, I don't really know many studies that have grandparents, parents, and children. And this is why animal models are used so that you can study the transgenerational impacts, but you've been able to study the intergenerational impacts, and you've also investigated aspects of Mercury that are not well studied, like the mental health, like etc. So you're delving into these areas that no one's been able to delve into because you just didn't have the retrospective data. And you're also exploring these, everyone looks at the neurotoxicity, but you're looking at aspects of mercury that you didn't really have a cohort to answer these questions, and you're finding amazing things. And I guess I just want to ask you, as another fellow mercury scientist, what impacts does your work have on mercury research? What directions researchers should be going in or thinking about? Maybe you could just, since you have obviously more of a global view than I do, just maybe share some of the impacts of your work. Yeah.
I think the secret, well, it's not a secret. The success of it is listening to people. We truly involve the community is part of the study. Grassy Narrows has a Mercury Justice team that's led by Judy, but we listen to what people say, and then we ask ourselves. Basically, we translate what as Judy said, we translate what they tell us into scientific evidence, if there is a relationship. Sometimes there isn't. But sometimes, I mean, people, as you know, people who have been exposed, particularly, this is one of the worst, if not the worst, Canadian disaster in our history. And so so I think the secret is to listen to what people are saying and understand the community. So that we go there often. The community is involved in in our grant applications, in determining what are our objectives. We discuss the methods, we discuss the results. And just as an example, we're now looking at metabolic changes, and last week I was in the community and we presented the results to the community. We heard a lot back from them, which helped us to interpret our results, to interpret our findings. And I think that's the reason why we look at things that maybe others haven't looked at, is because we listen to what people are saying and then asking ourselves with them, is this mercury related? Do we see this because it's related to mercury? And I mean, this community lives all of the issues that that other First Nation communities in Canada live. They went through residential schools. They went through the trauma of being displaced. I mean, residential schools, the kids were taken away from their parents. Then there was the 60s sweep, which wasn't residential schools, but they took kids off the reserve. And they were, as the people of Grassy say, adopted out. And some people say they were kidnapped and brought up elsewhere. All of this are very traumatic events that that affected their land has been taken away, their culture has been taken away, and all of these are things that are lived by most all Indigenous communities in Canada that are over the last years very well organizing and defending their rights. Grassy Narrows has all of this, and in addition, Mercury. So that what our role in this is to try and determine what is the contribution of Mercury to all of this. The contribution of Mercury, because because we can't take the mercury out. So how do we improve? How do they improve their quality of life? We hope that the Mercury Health Center will be an important aspect of it. But just as Judy said, knowing that it's not because they're crazy, as she said, and others have said, it's because mercury, because of the mercury is contributing to their mental health status, to their cognitive functions. And what I tell the teachers in the school at Grassy is, imagine that it's taken from Bruce Lanphear's Little Things Matter. Imagine that there are little holes in the brain, and that's like mercury, and the neurons are very plastic, and the brain is plastic and can make new links. And your role as a teacher is to get them to make links around the holes. And you've got to figure out different methods that will allow you to do this, given the cognitive issues. So that's the way in which we work with communities, and why we come up with things that other people haven't seen, because there is this, I think, false idea that scientists need to be distanced from their so-called subjects. We think that the subjects or the community with which we work should be involved in the study, and we are responsible for the scientific rigor. So that's why I think we come up with things that basically are not necessarily known or have not been published. The neuropsychiatric effects, interestingly, right, there's one other thing before I get to that I want to say, is that one of the things that happened with mercury is that most of the studies in mercury are with marine fish, with people who eat marine fish and mammals, whether it's the Seychelles, Minamata, the Faroes, the Inuits in northern Canada. These are all, and all of our thinking about mercury is driven by that. Now, compared to in Grassy Narrows, they're freshwater fish eaters. Freshwater fish do not have the beneficial nutrients that you find in marine fish and mammals. They have much lower omega-3 fatty acids, lower DHA, lower DPA. They don't have the selenium and probably many others. So that what I think and what we're looking at is that because of this, it takes less mercury to have these effects, because you do not have the counterpart or the counteraction of beneficial nutrients.
Well, I totally agree with that. The beneficial nutrients ameliorate the mercury. So, and if the kinds of fish that they're eating are not enriched in these beneficial nutrients, then you're going to see toxicity at lower exposure levels. And of course, they're highly exposed. So you're going to see just orders of magnitude worse effects. So,
yep.
Let me see. I think we're the only ones left. I think the students had to leave because it's 1 o'clock. I see one person online. Is there anyone? Of course, 2 people online. But
What is B?
one.
Oh, one is you.
Yes. There's someone named Brenda online. Brenda, do you have any questions that you want to unmute yourself and ask Dr. Mergler? I haven't seen. I don't see anything.
I have a question,
Please, CJ, you go for it.
Thank you for this presentation. I was totally unaware of this Grassy Narrows before all this, and then I found there's a lot of articles, luckily, about it, and what I see is that it was like the concerted efforts of, like, it's sad that they kind of pose it as, oh, it's not that ongoing, but it sounds like it's still under pressure. There's still increased mercury, and so they, like University of Toronto just did one of their universities just another study. So my question was, so was it, you see like opportunities, like, I don't know, but is it like for continued research in there, like for students outside or anyone outside of the community or health efforts? Like, I noticed the Mercury, this center that they probably are finally, this community had to really fight the government. Like, they promised it 10 years before they actually did anything. So, now it went on and on, but.
So you're curious if there's more research.
Like, because it's, yeah.
Dr. Mergler, you are.
Well, I can tell you that what we're looking into now is the effects of current mercury exposure. So it's not just past mercury exposure. Everything that we've looked at to date, we have not found effects of current mercury exposure, though the current mercury adds on to past I mean, over time, current becomes past, and it is increasing the amount of mercury. We're looking at things like how does past high exposure contribute to current mercury levels? Because of course we see the relationship between current fish consumption and mercury as one would expect, but the question we're asking is, does past mercury exposure contribute to current blood mercury levels? And for those of you who will be at ISES, one of the postdoc who's working with me just sent in an abstract about that. So that, yes, there's still a lot to do. And what's important, I think, right now is we've shown and are continuing to show the effects of mercury, long-term and short-term. And now the job both for professional caregivers or service providers and researchers are to determine, given what is happening, what would be the most appropriate therapeutic measures or care for people with mercury poisoning. And I think that it's not, I mean, when you look at the levels of mercury exposure in Canada, it's not only Grassy Narrows. Grassy Narrows was probably the highest, but mercury, the program that that looked at over 30,000 people, of whom 20% had values over the equivalent of 20 micrograms per liter of mercury, blood mercury, they too have probably have long-term effects. And one of the questions that one can ask is the how much is past or even present, but mostly past mercury exposure in First Nations across Canada who were eating freshwater fish contribute to their current health, which, as we know, is not as good as the health of non-Indigenous people.
Yeah, no, I think your work is also important because of all the communities, the ASGM communities, the communities that mine with mercury. There is there is some research, you know, by Stefan Bose-O'Reilly and a few others. But the potential for these intergenerational impacts are not ever considered, ever. But you think of the millions of people all over the world who are mining gold with mercury, and the potential for these impacts just are not, they're not being considered, and the intergenerational impacts are not being considered. So it's a tragedy. But your work really shows how important it is to look not just at the children who are important to look at, but to continue to look through the generations if you even can do that. So I mean your work, that's why your work is just so incredible to me, because you've done something with this cohort that really hasn't been done in any, I don't know any other cohort. Even the Seychelles, are they looking at the grandparents? I don't know. I don't think so.
Well, I would assume that they can now because it's been going on for a long time.
Yeah.
And you've had several generations, and they now have data for several generations. What was, I mean, when it was sort of an accident that we found that there was all this data available. I mean, we could have, even though you look at the literature, and I knew the literature about the exposures, it wasn't quite clear that this could be translated into databases. And I was reading a report that was done on school children back in 1996 on Grassy Narrows, and they talked about looking at their outcomes with cord bloods. And I said, oh, they have cord bloods. And so with Grassy Narrows, began trying to get their data. And not only did we find cord bloods, but we found, thousands of measures of historic measures of historic hair and blood measures. Clarkson did a lot of studies there, and Clarkson, 1975, studied Grassy Narrows. A lot of the data that we use in our longitudinal studies were Clarkson's measures. Actually, I believe that what we use as a ratio for blood to hair comes from Grassy Narrows and White Dog, the other community that that people from the University of Rochester used.
I think what's also incredible is the ability that the trust you've created within the community to even do this research. I mean, my own experience here with indigenous communities is you can measure the fish, but human health assessments are very, because they're so vulnerable, they so don't want data released and or without, and they don't want to be stigmatized. And so there's been definitely challenges. I mean, the potential is there for elevated mercury exposure, but just cultivating that trust. I mean, that takes years, and the fact that you've been able to do that and that you're returning the data. I loved what you said about OCAP and that the possession of the data, it actually belongs with them. And I just think those things take years. It just takes years. And so I'm truly impressed that you've cultivated those relationships and built that trust, because that's ultimately the foundation of all of this work.
What's my secret? And
Yes.
I have been retired since 2006. And would I have been able to do it if I were still working as a professor? I somehow doubt it, because the people I work with can, because I'm there full time, and full time and a half if you really want to know. But so that it takes time, and the way in which research is set up, the way in which the granting agencies are set up, it's not designed for you to take the time to win to show the community how that you do respect them, and to create this bond between you, the researchers, and the community. Grassy Narrows has been working with scientists for the past 40 years, and environmental scientists, and they know how to recognize people who respect their ways and people who don't. And they will very quickly say, no, this person, we don't want to work with this person. This person does not respect our people. And often because, what unconscious biases are very present in society. And that's what I tried to explain to the physicians at Grand Rounds, is that they see somebody who, and Mercury, one of the things it does is it affects your coordination. You're not in a wheelchair, but it affects your coordination. And so they see the person arriving, poor coordination, immediately it's alcohol. Well, data shows that basically overall today they drink less than non-Indigenous people. But these stereotypes remain, and these stereotypes affect how they get the care that they get or they don't get. And so, but it takes time to create this trust. And when we did it was during the community health assessment. That's when we created the links and the community members. And I've now worked with five different chiefs, and they may not agree on different things, but all of them agree that something has to be done about mercury poisoning. So that I've worked with a whole series of different chiefs who may have different ideas about different other things, but not about mercury.
Incredible. Wonderful. You're making me think of my colleague Sunil and his research in Botswana. He works with the village chiefs, and the trusts that he's built with the village chiefs enables him every year to go and bring students and do research that the village wants to see done. And he's doing this incredible research entirely because of the connection he has with the village and the leaders of the village. So yeah, so what do
Well,
you yeah, please.
but that is the, it's not a secret, that is the reason why he can do it, is that he's responding to what the community wants.
Yeah.
We are too. I mean, I have one slide where I sort of show community members. I didn't include it here because I had too much to say, but where we have community members and what they say, and how they say how they feel and what they want. And sometimes you agree with it, sometimes you don't, but you respect that this is what they think, and that and what they say and what they want done, and you work with them. And I must admit that we now have, for the Canadian Institutes for Health Research, unfortunately, we do not have an environmental health institute like you do in the US, but we do have an institute for indigenous health. And the Institute for Indigenous Health creates the rules by which you do research with indigenous peoples, one of them being OCAP, but there's a whole lot of others as well. And there are a whole lot of indigenous scholars that are now more and more involved in both at universities and in the Institute for Indigenous Research, for Indigenous Health Research. It's part of CIHR, that said this is the way it should be done. And likewise, there is now funding for like catalyst grants and planning grants, dissemination grants that allow you to take the time to do this.
Yeah, I like the idea of the planning grant and the dissemination grant. I like the dissemination grant. That's the piece we always miss, you know? you do the research, you publish, but the dissemination part, it's so, I mean, that's the part you just gloss over, and yet that's the most important piece, or one of the.
And and they're not large grants, but they're enough to get you a couple of meetings with communities and to bring you to where you're going and to develop. I mean, the community health assessment. There was a young Indigenous woman who made a little booklet out of the results, so that the community had access to it. The same way we did it in the Amazon when we have Castillo, a little booklet that explains mercury, what it does, how it affects you, and what can you do about it.
So are you still, I mean, I know you have retired in theory, you've retired, but are you still advising? Do you have students? Do you have postdocs or none of that really? None.
Okay, I retired 20 years ago. I still had doctoral students for the first, I don't know, maybe 5 years. No, I don't have students. I don't give courses. I don't do university administration. I just do research because that's what I enjoy. I have a postdoc with me, but she's somebody who had experience she's very independent. She had experience as a federal civil servant. So when she decided to do her postdoc, so that no, I don't get involved in. I try not to, but I try not to get involved in university affairs, but I do a little bit. But
Okay.
I'm just enjoying what I'm doing.
Yeah.
And I did retire 20 years ago. And all this because, well, it's, I don't have an employer.
Yeah, no, I think that's so inspiring to me is this.
The
is this
downside is I don't have money, but the upside is I don't have an employer.
I understand that. I understand that. And you have the time to cultivate this important relationship, which leads you into this whole research world, which, as you said, you wouldn't have been able to do this if you've had all the responsibility of a tenured professor. So
Yeah.
the fact that you're doing this is just incredible.
And the fact that I have the time to do it permits other professors to work with me
Oh, okay.
because I can do a lot of the things that they basically don't have the time to do.
Right. 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 Okay.
Yeah. And, so
Yeah.
what I tell them is retire. I retired exactly 20 years ago.
I know. That's when I met you. It was like June or July of 26. It was, or 2006. We were at
That's right.
the Madison, Wisconsin Mercury conference. And
That's right.
you were on the plenary.
Yep.
You gave a plenary on the Amazon, on your research in the Amazon. And it was like the first time I'd been hearing that. I was working in a mercury lab, but nobody was doing human health. I was in an engineering program. So it was the first time I was hearing talk about human health and exposures and how you had this whole research program. Again, you were working, partnering with communities in the Amazon.
We always have.
Yeah.
We always our research group Symbiose, that's what we've always done. And our university, which was a young university back 50 years ago, 60 years ago, We had what's called service to collective groups. And that's where we developed. I began doing occupational health with and working with workers and unions and learning to listen to people. That's where it all started.
Mm.
And we negotiated back in our collective agreement that we could do the equivalent amount of time rather than do a course at a university course, do workshops with workers or communities, or I mean, it went through the university. There's a service called university service called that has a joint committee with community groups, unions, women's groups, and the university. And the community groups can ask for research. Basically, it's for groups that are not normally served by the university.
Wow, that's what I love, that innovative idea that you were teaching a class, but teaching it to workers, and it didn't have to be part of some funded research project, that it was just part of your teaching load. And
Yeah, it was part. Yeah.
which is, I just think I love that innovative idea. I love that. I wish we could implement something like that here, because I think there's a lot of people who would, I mean, I would love to be doing work more closely with the community, and for it to not be on top of, as you said, everything else you do for a university when you're working there. So yeah, gosh.
Yeah, well, I mean, look up the UQAM's or the University of Quebec in Montreal service to collective groups. I'm not quite sure how they translate it, but there are documents in English, and we've published in English. And I think Karen in her books, Karen Messing in her books on women's occupational health, describes very well this link that we have. I mean, we likewise have, continuing education, but that's individual. Here it is basically to work with groups that want to improve their situation.
Wondering, are you doing more of the mental health research as well? I saw that there's a lot of social justice now that the younger generation, of the Grassy Narrows is wanting or like studying. I'm just curious, since it's your own research, whatever you want to do. I know. I like that you included the suicide in there.
I couldn't hear. Is there a question there?
Oh shoot.
Oh,
Yes.
yes. Please.
That's
DJ.
weird. I don't know why it did. Can you hear me now or no?
Yeah,
Here.
now it's better.
Come over here. Now it's better. I was wondering if you're still doing like the mental health research, because I found social justice is big in that community, and there's continued like more stories of these reasons that there's problems in the area. So I wondered, now that it's your own research, are you sticking more to the environmental or still looking at some of that?
I think it's the connection.
My expertise is looking at the impact of environmental pollutants on health. Now, what we do is, I mean, I'm working with one of our team members is an Anishinaabe scholar. He's got a Canadian chair at Lakehead University, and he's a psychologist. He likewise has an Anishinaabe clinic and so he has been involved in the mental health aspects of our study. And he will be involved because there is a child study that is being planned now, and he will be involved as well in the child study. So the idea of, I mean, my role as well was to get together a team of people with all sorts of different expertises in order to work with the people of Grassy Narrows. So that, we have, for the vision, we have optometrists, for mental health psychologists, we had a general physician, a neurologist, a whole, all sorts of people to look at the different aspects and to work with the community for what to do with these different aspects.
Thank you. That was very much what I was thinking. Like we keep talking about collaborative research and crossing disciplines and all that.
Yeah, Donna's work has just created new frontiers. New frontiers. That's how I see your work. You're creating new frontiers. So many of us are stuck on one aspect of Mercury, and you've just the whole field has exploded because of your work in Grassy Narrows and the Amazon as well. But this recent in the Grassy Narrows, it's just all these areas that people do not look at, never look at. You've been looking at them and saying there are associations we have to look for. And I think that pushing the field ahead in that way it's just been tremendous. It's been tremendous for the field. So yeah.
Thank you.
Absolutely.
I appreciate that. It
Absolutely.
makes it worthwhile when as you get older, your days get shorter.
Well, it's an inspiration to get to talk to you. Always get to talk to you and communicate. And I do hope we get to meet in person this year. So
I hope so.
yeah, I'm gonna email you because I'm gonna try and make that happen. I'm sorry that we couldn't bring you here. So
Oh, I would have loved to be there. I mean, it's such a beautiful place too. It would have really been nice, and I would have said yes right away, as you know.
I know you said yes a couple of years ago.
That's right.
22, you told me, "Oh, I'd love to."
But then you,
yeah.
Yep. But then your country changed, and there's a border between, and there's there's a border between us.
We're trying to change that. We're trying to change back, and
I certainly hope.
Yeah, fingers crossed. But
Yep.
yeah, we're yes, and we have really failed our Canadian colleagues. Our government has failed our Canadian collaborators and colleagues, and I truly hope this does not define the future. So, because it's obviously impacting so many relationships. I know you told me that you have family in the US that you're unable to visit. So,
Yeah. But I invited my cousin for her 80th birthday to Costa Rica.
oh,
So that that was nice.
okay. Well, I too hope to make it up to Canada. So I'm gonna email you separately and try to
Please do.
for sure.
Please do.
Does anyone
Yeah.
have any further questions? I know we said 1 to 2, but I think it's just you and me, and it's just it's just Matthias, CJ, and myself that are here. Does anyone have any other questions?
I have.
Okay.
May I? Because I mean, I know that the time is short, but yes, I have.
Go ahead.
when I try to choose one, well, I am a midwife, so usually I I had tons of questions about fish if during the pregnancy, and many pregnant women were asking me, "Do I? You know what I mean? May I eat sushi? May I eat this kind of fish?" So my question is, do you have a sort of advice for prevention? For mainly for prevention?
The 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 problem with, I mean, there are a lot of nutrients in fish. There are good aspects of fish,
Yeah.
and there are a lot of contaminants. It's not only depending upon what you're eating and where you are. In Grassy Narrows, it's only mercury, but elsewhere you've got all of the organic pollutants. You've got uh, PCBs, DDT, probably PFAS as well. But it's just not eating that much. I mean, when I go to Grassy Narrows, I eat walleye, okay? But it's not going to harm me because I'm not eating it every day, and it's not my dietary mainstay. For the people of Grassy Narrows, it was their dietary mainstay. And so and the same thing in the Amazon. It was their dietary mainstay. This is what they ate. So eating sushi from time to time I mean, you're not taking in that much mercury.
Got it. Thank you.
Yeah, so Matthias and I just started working together, so he hasn't been inundated yet with all the mercury literature. So I will promise to inundate you.
Maybe soon.
You will know a lot about mercury a year from now. You'll say, "Oh yeah, now." So, but Donna just gave you the best overview, introduction, and just depth of research. I mean, to get all this in a lecture is just incredible. So, but did you have another question? Did you want to?
No, I'm fine. I'm very clear. Yeah, I mean, I have, for instance, where the symptoms are the signs to detect for an early detection of poisoning with mercury. I don't know if that would be important because, I mean, if the person already has high levels, I don't know if you can do something over time to, I don't know, sort of screening if in the disease of, I mean, if the levels of mercury are very high, you maybe, I don't know if there's much that you can do about it, or is there a way to have a very good screening, putting an eye on certain signs or symptoms?
Well, you can know about current exposure. You can't necessarily know about past exposure except from what people tell you, or if you have measurements as we did from past exposure. You can measure mercury in people's blood. You can measure mercury in people's hair. That will give you an appreciation of what they are currently exposed to.
Okay.
But like when we were in the Amazon, when we came back, we did analyze mercury in our hair. It's even published in Ambio, and as a short article. And you saw very well, because in the Amazon we ate fish. You saw the mercury go up, and then over time we waited some weeks before we cut our hair, and you see it go down. So that it's really related to what you're eating. The problem is the major problem with depending upon where you are. I mean, fish and walleye, which is a high-end predator, was the center of their lives in Grassy Narrows. When you ask, it's tough to do statistics with fish consumption because just about everybody answers they ate fish every day.
Thank you.
Yeah. Yeah. You know, my students, I have to just tell you a story. I, have a direct, not a DMA, I have a Lumex. And I invite all my students into the lab and my undergrads, my grads, I invite everyone into the lab to measure their hair mercury. And we just do it as a kind of fun exercise. But every once in a while, I have a student with elevated mercury. And then I just talk and we talk and they're usually eating a lot of high mercury fish like swordfish, and I'll say just come back, just you need to eat low mercury fish, and we talk about that, and then I invite them to come back and I'll do their hair mercury again just to make sure that their levels are going down. But last year I had a student, her hair mercury levels were 8, it was like 8 ppm. 8 ppm. So almost 8 times higher than the reference dose. And it turned out she ate halal. She was Muslim. She didn't trust the meat in a restaurant, even if it said it was halal. So she was eating fish maybe 3 times a day. And so she was just eating fish at all these meals, and she herself was fine. You ask about, are there signs of mercury poisoning? Well, no, she's really smart. She's capable. She came to class. She got all A's, she was this outgoing student. And it was only when measuring her mercury did I started wiry, okay, your mercury levels. And we did historical because she had long hair. So we did historical and then we did recent. And her historical was lower, like 2 or 3 ppm. Still high, but not nearly as high as new recent. And I just made me think, like, here's a vulnerable community. Here's someone that nobody thinks about, the Muslim community, how frequently this idea that eating fish, which is safe for halal, but is not good. I mean, over time, you can, you can ingest too much mercury. And I haven't been able to pursue it, but it's on my list of like things I want to do. Just to focus on that community, because it may be a very small percentage within that community, but she was the most elevated person I'd ever measured, ever. And that includes China, that includes that includes all of my studies. That I've never had mercury levels that high. Or I should say I'd see somewhat higher levels in Bangladesh. And maybe among people using ASGM, but for people who don't have occupational exposure, she was by far the highest, and just very, just just eh, yeah, and it worried me.
That's
Yeah,
yes, and it's good that you did that because you don't see it right away. This is the thing. It with mercury, it's you don't see it. I mean, you don't see it in the young children in Grassy either. As they get older, you see it. If but they've been exposed in utero. Donald Cole some years ago did a study in Canada with different ethnic groups in the Toronto region around Lake Ontario. And there's a lot of fish in the Asian population. A lot of people are eating fish there. Their levels, I believe that the Asian population was higher than others, but that would be a very worthwhile project to get students to do, to do some sampling in the different communities in your region, because
yeah.
there may be a group with high levels. They get sick, and individually nobody knows why they're sick.
No.
And when they do get sick, well, you can't take the mercury out.
That's right. You can't put the genie back in the bottle.
Yeah.
You can't.
Yeah, I'll let you know of when our manuscript on mercury and metabolic. Yeah.
That's to be interesting because the associations with metabolic disease have been uneven. They're not consistent.
We think we know why they're not consistent, but
Okay.
we will see.
I bet
We
you
will see.
will.
If you know of anybody, who has a database that they would be willing to share with us to validate our data, that would have mercury, blood mercury is fine, or hair mercury. We'd prefer blood, but hair would be fine.